Hi, how are you?
Good.
What brings you in today?
I have this pain in my foot, and when I walk it just gets worse and worse. And by the end of the day it is just really painful.
And how long has this been going on?
I would say a couple weeks. I have been putting ice on it, using a compression wrap. I also have been taking ibuprofen, thinking some of those things would help, but they have not.
Okay, and it is which foot?
The left foot.
Okay, can you take your shoes and socks off from both sides?
Sure.
Can you tell me exactly where you feel the pain?
It is right in here in my plantar.
Okay.
And when I push up, that is when it hurts. I can move side to side. It is just when I lift up.
Okay, 0 being no pain and 10 being the worst pain you have ever had. How would you rate this pain?
I would say a 3 or 4.
A 3 or 4? And do you usually feel it by the end of the day?
Oh yes. By the end of the day it gets hard to walk on it. But it gets progressively worse all day.
Okay, and what work do you do?
I am an electrician.
Okay, and are you having left leg pain?
No.
And you are having pain on the left plantar?
Yes, that is correct.
3 to 4 severity, and gradually gets worse as the day progresses. And is worse when the patient dorsal flexes his foot. And is an electrician by trade. Most likely this is an overuse injury. So most likely there is a tendon of the foot getting irritated when you are using it. And as you continue to use it, you feel more and more pain. Usually this type of thing will get better if you take an anti-inflammatory for a couple weeks on a regular basis.
That is what I have been doing. 2 ibuprofen in the morning, and 2 ibuprofen 4 hours later. I have been doing that every day.
Are you taking 400 milligrams or 800 milligrams?
It is just 2 of the regular ones, whatever that is.
The over-the-counter ones?
Yes.
That would be 400 milligrams each. Okay, so I can probably give you the 800 milligrams, which is the prescription strength. The other thing is that you have to rest it, so I can put you in the boot. That will help keep your foot in a neutral position. So since you were moving it all day, when you were walking and moving it, probably that boot will stop the movement and let the tendons heal. That way you can still work, if you can. But I think that will be the best thing. And you can keep the ace bandage on it too.
Alright, what about a high ankle brace? Would that work?
No, because that would stop the ankle from moving, but you would still have the foot movement, and since that is what causes the pain you need to stop it from moving like that.
Alright.
This sounds like a tendinitis. And this will get better with rest, heat, compression, and anti-inflammatories for a couple of weeks. You would have to give it enough time so that the irritation goes away. If you do it for a couple of days, and take it off, it will just get inflamed again. So make sure you follow instructions entirely.
Alright.
And you have not had any injuries there?
No, not that I know of. It just hurts real bad.
Okay, I am also going to get an X-ray of this part to make sure there is not some problem with the bone. There is some swelling of the left foot, and significant tenderness noted in the dorsal aspect of the left foot. Can you move your ankle up and down?
Yes, but it hurts.
When I touch your ankle here, does it hurt?
No.
Okay, no tenderness noted in the ankle anywhere, but he does feel pain on dorsiflexion of the foot. Can you walk for me?
Sure, it doesn't hurt when I push. Just when I lift up my foot. Last night I elevated it, iced it. Because it was swollen. I did that for 30 minutes. Just sitting in my chair. Then when I got up to remove the ice pack, it hurt really bad. I finally turned to my wife, and I said I really need to get this looked at.
Okay, so we will get an X-ray to make sure it is not a bony issue. But the way you are describing it, it sounds like tendinitis. So we just need to give some rest to it, and it will feel better. Okay.
Okay.
And I will do the ibuprofen for you. It is 800 milligrams. And you will take 1 tablet 3 times a day. For the next 2 weeks. And I will give you a script for that boot. That will also help. I want you to do stretching. Since you will be in that boot, not stretching for 2 weeks, you can get a contracture for that muscle. And that can be a problem.
Okay.
So make sure you are stretching, in the morning and at night. Leaving the boot off to sleep.
Okay.
In the daytime, definitely wear that boot. Okay, so I put all of those things here and sent those prescriptions. You will do the X-ray here, and after that you can leave. And we will give you a call back if there is anything significant.
All right, sounds good.
Give us a call back if there is anything. Do you want a flu shot today?
No, thank you.
Oh, okay. I see you take methotrexate. Why do you take that?
My psoriasis.
Okay, let me see. Because ibuprofen might not work with that medicine.
They actually just recently took me off of it. They took me off of it like 2 weeks ago.
Okay, so you are not on the methotrexate at present. I will just discontinue that on your chart.
Okay.
Aside from your psoriasis, what other past medical history do you have?
I have type 2 diabetes, COPD.
I see, you are on metformin for your diabetes. Are you taking anything for your COPD?
No, I have been just trying to quit smoking.
You should definitely stop immediately. How many cigarettes do you smoke a day?
I used to smoke an entire pack a day. Now I am just smoking half a pack a day. But I will definitely stop soon.
Do you drink or do any illegal drugs?
No, I don't.
Okay, I will give you a handout with helpful tips to stop smoking.
I appreciate it, doctor.
No problem. I will schedule you for a follow-up in 2 weeks to ensure the tendinitis has resolved and check on your progress to quit smoking.
Thank you, doctor. See you then.